Hi, and welcome to another Progressive Short Take. Um, I'm Joe Firestone, your host, and this short take is about our need to reclaim our public medicine system. Uh, and there was a very important article that appeared in Common Dreams. I'm going to share the article for you and go over it. It's not gotten a lot of play in the press, but I think it's very important. And the title of the article is Reclaim Public Reclaim Public Medicine for Public Health. And it was written by Dana Brown, uh, uh, Alex Lawson of Social Security Works fame, Christopher Morton, and Fran Quigley. So 4 co-authors to that one. I'm just going to read through the article and comment on it from time to time. Far too many people have suffered and died because our medicines and our medical products and our medical product system was not prepared to respond to the COVID-19 pandemic with prompt and universal access to reliable tests, treatments, and vaccines. Governments, nonprofits, and industry in the United States and around the world are working furiously to catch up, but their efforts have been hampered by fundamental flaws in our profit-driven pharmaceutical industry. In other words, the private sector has not speeded up the process of bringing an end to the pandemic, but rather has slowed it down. Competition has slowed it down. For Americans with diabetes, cancer, asthma, infectious diseases, mental illnesses, and a myriad of other health issues, those flaws have been causing suffering and even death for decades, from growing shortages in essential medicines to lagging innovation, dangerous mislabeling and misbranding, and the highest prices in the world. America's pharmaceutical sector is clearly not meeting the needs of our society, and I would argue, is clearly not meeting its obligations to our society. It has an obligation to our society. All corporations have obligations to society. Our pharmaceutical sector, which is full of corporations, is not meeting its obligations to society. The current crisis has brought these problems into even sharper focus, says the article. Now is the time to redesign our medicine system to effectively, equitably, and rapidly address and anticipate crises like the current pandemic. This can and must be done while also providing a safe, consistent, and affordable supply of essential medicines to all, including persons with health challenges beyond COVID 19. And the article goes on. Pharmaceuticals or medicines were long considered a public good, off limits to corporate profiteering, price gouging, and monopolizing. It is time for us to reclaim them as such. We must transform the U.S. pharmaceutical sector so that our nation can successfully combat this crisis, prepare for the next one, and ensure that millions of people have access to the essential medications they need to live healthy lives and participate in society and the economy. To do so, we must take these 4 steps. 1. codify open science practices that accelerate innovation, reduce costs, and strengthen the evidence base on which our medicine system rests. Quote, open science, unquote, broad, ready, and equitable access to scientific knowledge and to the data that generates that knowledge across the drug's entire life cycle is essential to focusing research and development activity on the most crucial health needs, accelerating R&D, expanding competition, and preventing monopolization and reducing costs. We must provide access to the, quote, means, methods, and materials, unquote, of biomedical innovation, including various preclinical, clinical, and financial data that is currently kept mostly hidden by industry, government, and academia. This could be done in two phases. In phase one, the National Institutes of Health, the Food and Drug Administration, and other public agencies, including the public sector vaccine and pharmaceutical agencies we describe below, would begin discretionary sharing of preclinical and clinical data they hold. Government-held results of experiments and clinical trials and information on the cost of this research can and should be shared regardless of if the results are generated by government, industry, or academia. Such data sharing would make it easier for researchers to replicate research findings, reduce redundancy, and other efficiency, and speed the development of new therapies. Phase one could be achieved immediately through agency discretion without changes to existing law. However, Congress could maximize the benefit to the public by making this data sharing mandatory. Phase two would extend open science to manufacturing. Sharing data and know-how on manufacturing processes would accelerate the development of new drugs, especially biologics and biosimilars. This would break our monopolies and lower sky-high prices. To achieve this, Congress should amend federal statutes such as the Food, Drug, and Cosmetic Act or the Biologics Price Competition and Innovation Act to require manufacturers and the FDA to share information that is currently protected as trade secrets once the appropriate exclusivity period has passed. Congress should also provide the FDA and Department of Health and Human Services discretion to share manufacturing information and clinical data too, sooner, before the exclusivity period expires, to accelerate competition in the event of anti-competitive conduct or pressing public health needs. The Patent Act should also be reformed to raise the bar to patentability, require patent owners to disclose more useful information, and discourage dense patient thickets that overprotect drugs manufacturing processes. Item 2, create public sector capacity for full cycle pharmaceutical innovation and the production of essential medicines. The U.S. should establish a public full cycle pharmaceutical R&D institute and one or more public sector pharmaceutical manufacturers. These institutions would work together based on a new bottom line, the public good. The American public already funds many breakthroughs in the discovery and development of new drugs, far more than even the largest of the drug companies, but we currently depend on those companies and the profit motive to get those breakthroughs to patients. And it takes far too long to get the breakthroughs to patients in many, many cases. Public sector institutions could work together to reimagine the innovation cycle from start to finish. They could direct discovery efforts at the disease areas most important to public health and lead the world on open science, embracing and expanding on the data sharing aspect of industry. Also, as public sector actors, these institutions would benefit from the, quote, patient capital, unquote, investment not expected to turn a quick profit, needed to engage in the long-term, uncertain process of discovering and developing truly revolutionary science. Public pharmaceuticals with lower prices return the revenues to public balance sheets and reduce inefficiencies while building in-surge capacity for crises. They would foster a more resilient supply chain and ensure broad, equitable access to new drugs through public interest management of its inventions. These institutions would be a source of stable public sector jobs, themselves an upstream investment in health. By breaking Big Pharma's monopoly on our medicine supply, public sector institutions would also begin to erode its capture of our political system. We sure need this in many areas. For example, in the contest for the first congressional district seat in Congress, with Alex Morris, Kay, and Richie Neal running against each other. Alex Morris has a tremendous hill to climb because of Big Pharma's capture of Richie Neal. The U.S. public sector has a long tradition of path-breaking innovation, from development to the internet, to HIV prevention therapy, to putting people on the moon. It is incumbent upon us to also wield the full power of that public sector innovation engine in order to develop the medicines our society most needs and assure equitable access to them. 3, use the full power of compulsory licensing to ensure access to essential medicines. The federal government should use its existing compulsory licensing power to either directly manufacture essential medicines or allow others to do so. This will ensure adequate supplies and equitable, affordable access. Under 2 different U.S. statutes, we already possess full legal rights to bypass the barriers of privately held medicines patents. So why don't we? Why don't we do that? The reason why we don't do that is because of the takeover by neoliberal ideology and neoliberal movements of the government and of the public sector. Because even though we possess the full legal rights to bypass the barriers, we still don't want to do it because we feel that somehow the private sector has a right to the profits, and that the profits, the property, is more important than the people. There is a long sector of the U.S. government issuing compulsory licenses to respond to crises like the one we face but today, ensuring affordable access to medicines and technologies in the medical, energy, and other sectors. In response to the COVID-19 pandemic, several nations are already taking steps to issue compulsory licenses for medicines and other medical technologies. Beyond the present pandemic, we must also recognize the everyday crises of lack of access to many essential medicines, whether driven by shortages or prohibitive costs, and use compulsory licensing anytime access issues to jeopardize public health. Extending the U.S. government's compulsory licensing power beyond patents to trade secret manufacturing, information, and regulatory exclusivities, as described above, will ensure that these barriers do not jeopardize public health either. Compulsory licenses call for a reasonable royalty to be paid to the holder of the patent instead of the typical massive monopoly markup. Therefore, prescription drugs manufactured through compulsory licensing can be much cheaper, while innovators are nonetheless compensated for their work. And I bet they would be more than fairly compensated for their work. 4, take the vaccine industry into public ownership to assure its products are available to all. And this one is very, very important. Vaccines are not an effective market good. In fact, they are an essential public good. Only a robust public program of vaccine development and production can meet our public health challenges. In a profit-driven pharmaceutical industry, Vaccines for infectious diseases simply do not offer the kind of return on investment that owners believe they deserve. This has led most major pharmaceutical companies to pull out of vaccine development altogether, leaving us with a highly consolidated and non-competitive oligopoly of producers, none with the capacity to alone produce a coronavirus at scale. Yet current U.S. policy is built on the presumption that the same disinterested corporate actors are the only ones capable of bringing vaccines to market, despite many historical examples to the contrary. And we're going to have a historical example right now, I think, because China, I believe, is getting very close to having a vaccine and bringing it to market. And they're not doing it through the private sector. Deprivatizing the vaccine industry would be a major step towards establishing the full public sector capacity needed to assure essential medicines are accessible to all. Such deprivatizations in times of emergency are commonplace, and the U.S. has specific experience with public sector mobilization of vaccine development and also production, including our highly successful vaccine program during World War II. The public laboratory in Canada recently led the development of the Ebola vaccine, and the U.S. public has already invested billions in vaccine development through federal agencies. By taking the vaccine industry into full public ownership, we can provide an internationalized response to this and future pandemics that properly recognizes vaccines as a global public good. Vaccines developed in the public sector should be licensed through a global pool or developed and marketed without patents altogether so that they are available to all, ensuring the prompt and equitable access necessary for coherent public health interventions. A federal vaccine development agency could break with industry's tradition of secrecy and commit itself to data sharing, accelerating innovation around the world. And here's the conclusion. The COVID-19 pandemic has revealed shocking deficiencies in our country's commitment to the health of all Americans. The choice to prioritize corporate profits over the research, development, and distribution of effective, affordable pharmaceuticals has proven deadly, just as it has for Americans who have been facing dire access challenges for decades. We are confronting the challenge of our lifetimes without the tests, treatments, and vaccines we need. Yet more and more public money is being pumped into a system best placed to produce duplicative Me Too, quote unquote, drugs that generate excessive profits but have little or no impact on public health. The pandemic has taught us a brutal lesson. It is time to reclaim our medicine system for the public good. These 4 steps are the way to begin. There are a number of organizations that signed this article, that undersigned the article. They include the Action Center on Race and the Economy, the AIDS Foundation of Chicago, the Albuquerque Center for Peace and Justice, also American Family Voices, the Black AIDS Institute, the Center for Open Science, the Center for Popular Democracy, Columbia University Students for a National Health Program, Congregation of Our Lady of Charity of the Good Shepherd, U.S. Provinces, Consumer Action, Democratic Socialists of America, Health Workers, a Collective, Faith in Healthcare, the Health Global Access Project, IMAC, Indivisible, Iowa Citizens for Community Improvement, Just Care by USA, Latino Commission on AIDS, Lupus Chat, the Maine People's Alliance, National Advocacy of the Sisters of the Good Shepherd, the Network Lobby for Catholic Social Justice, People's Action, Physicians for a National Health Program, Progressive Doctors, the Right Care Alliance, Rights and Democracy, New Hampshire and Vermont, Social Security Works, T1 International USA, the Democracy Collaborative, 0 Hour with RJ Eskow, the Treatment Action Group, the United Vision for Idaho, the Universal Healthcare Action Network, the universities Allied for Essential Medicines of the UAEM, the Washington CAN, and individuals, Dana Brown, director of the Next System Project, okay, and the Democracy Collaborative, Alex Lawson, the executive director of Social Security Works, Christopher Morton, the fellow and supervising attorney of the NYU School of Law, Fran Quigley, a clinical professor of law, Health and Human Rights Clinic, okay, Indiana University, the Robert H. McKinney School of Law, Adam Heggie, associate professor and program director of the Appalachian State University. Alexandra Greenberg, who's a medical student at SUNY Downstate. Alexandra Sundell, human. Allison Case, MD. Amanda Ramsdell, MD. I think I'm going to stop it here. I'm not going to go through all the names of individuals. There are many, many names, okay, of those individuals. Had I been asked, I certainly would have signed up for this, okay, in a New York second. So, I certainly endorse this proposal, and I wanted you to take notice of it. Okay, I wish that I had been a signer. So, I think I'm going to end this here. I'm going to remind you once more of my I'm going to remind you once more, okay, of my Patreon account. It is at patreon.com/Joe_Firestone. And I'll end this progressive short take now. Thank you very much for watching.